A hearty good afternoon and welcome to a session on irregular cycles and fertility. We're glad to have Dr. Renuka among us today to help us understand the topic. Irregular or abnormal cycles account for a lot of cases of infertility. So the doctor will take us through this process and help us understand more about this through some helpful tips and more on the topic. Doctor, you have the stage.
Thank you. Thank you for the introduction. I'm Dr. Renuka, fertility consultant from Apollo Hospitals, Hyderabad. So today we'll know a little about irregular cycles and how it is going to affect a woman's fertility, reproductive capacity. So regular menstrual pattern is very important for a woman to become pregnant, and the unpredictability of irregular cycles is very much frustrating for any woman, more so for women who are planning to conceive. So today let us know about what a menstrual cycle is and how a normal menstrual cycle happens, and what are irregular cycles, and what are the causes of these irregular cycles, and what are the available treatments currently we have to overcome this problem. So usually 75 to 80% of women will have regular cycles in general. That is, they will have a menstrual cycle for every 26 to 32 days. And the flow usually lasts for around 2 to 7 days of period. And these women, they won't experience much of pain during these cycles. And with minimal discomfort, they go through these 2 to 7 days of cycle. This is how the cycle length and the flow days are in a woman who have regular cycles. So when a girl attains around 11 to 12 years of age, usually she starts getting these menstrual cycles, and these menstrual cycles, they continue until a woman reaches her menopause. Usually that is at the age of around 45 to 48 years for an average Indian woman. So this is the usual menstrual pattern which happens when everything seems to be normal. So what happens during this menstrual cycle? What are the important events which happens in this menstrual cycle, and which how a woman can conceive in these menstrual cycles? We'll discuss a little about this. When a woman gets her period, from second day of her period, usually a batch of eggs, there will be a lot of eggs in the ovaries, in the two ovaries which women has, and a group of eggs which are around 20 to 25, a group of 20 to 25 eggs, they come into growth phase from the second day of the period. And under the influence of hormones which are secreted by the pituitary gland in our brain, so like hormones like FSH and LH, when these hormones are in the right amount, among these 20 to 25 eggs, one egg will start growing, and it gradually grows over a period of around 12 to 16 days. Usually it will take 12 to 16 days of time for an egg to grow gradually and mature. When it is growing, it will be releasing a hormone called estrogen, under the influence of which the lining of the uterus also grows, which makes it ready for the implantation or for the nourishment of the coming pregnancy or coming embryo. So once the egg growth is completed within 12 to 16 days of period, again the egg will be releasing certain hormones which will signal the brain to release one more hormone called LH, which is important for ovulation. So when the mature egg is ready, there will be sudden rise in the hormone called LH, which will initiate the process of ovulation, that is egg release. And once this process is initiated, within around after 36 hours of this hormone spike, the egg will be released. And when the couple are together around this time of ovulation, usually the egg fuses with the sperm and it forms into an embryo, and it goes into uterus and gets implanted, and the pregnancy will happen, and the woman doesn't get period after uh, this pregnancy happens or the implantation happens. She misses her period. When, if at all, the woman is not pregnant or the fertilization hasn't happened, then after 14 days of ovulation, usually the woman gets her period. That means the last 14 days after the ovulation, it is constant. If the ovulation has happened on 12th day, the woman will get period on her 26th or 27th day if it is not fertilized or if she is not pregnant. Or if the woman ovulates on 16th day, she will get her period on 16 plus 14, that is on 30th day of her period. Or if the woman has ovulated on 20th day, so if she is not pregnant, she will get her period on 20 plus 14, that is 34th or 35th day. So the cycle length depends upon when the ovulation has happened. If the pregnancy doesn't happen with the released egg, then that particular woman will have period after 14 days of ovulation, which is very much constant if the hormones are reasonably normal. So this is a rough or easy way to understand what happens in a natural cycle when a woman's period is regular. So when we call women to have, or when we say that the woman is having irregular cycles, usually, as I already told, most of the women, they get cycles for every 26 to 32 days. A woman is said to have irregular cycles if her cycles are coming more frequently. Like if she's getting cycles for less than 21 days, if she's getting for the cycles for every 18 days or 20 days, any period which is happening within 21 days of her cycle, that is called irregular period. Or if she is having period a little later, like more than 35 days, if the cycle length is more than 35 days, then also we say that the woman is having irregular cycles. And if the flow is more than 7 days, or if the flow is less than 2 days, then also we say that the menstrual cycle is abnormal. Some women, they come to us that they have regular periods, but they get it for every 20 days. Even then also it is not normal. Even though her cycles are regular, she is getting cycles for every 20 days every time on dot time. Even then we have to say it is not normal. Even short cycles, we call them as short cycles, even though she is having regular, they are not normal, they are abnormal cycles where the woman needs evaluation. Similarly, if the woman says that she is having cycles for every 60 days, or say for every 45 to 50 days, then also we say that she is having irregular cycles, even though she is getting her periods regularly for every 45 or 60 days also. It is to be considered as irregular cycles. The main thing is, if she is not able to predict when she is going to get her next period, that is very much important to say that she is having irregular cycles. One more is, if she is having very short cycles, that is less than 21 days cycle length, then also we should say that she is having irregular cycles. Or though regular, abnormal menstrual cycles, or when the woman is having longer than 35 days period, and even though they seem to be regular, say every 2 months or 3 months, then also we should say that the woman is having abnormal cycles. So the most important thing to conceive for a woman with proper menstrual cycles is she should be able to predict when her cycle is about to come, and her cycle length should be between 21 to 35 days. Any sudden changes of the cycle length, or what you say, any slow shift from the cycle length. If previously she was having any the 30 32 days cycle, and gradually they are becoming 45 to 50 days cycle, or they are becoming shorter, this is to be taken as a warning symptom, and it should be evaluated properly. So you should observe your cycles from the beginning, how the cycle pattern is and all, and then you need to know whether your cycles are normal or not. You need to keep a watch on your cycles, especially when you're planning for a pregnancy. The predictability of the next period is very important, which you should not forget. especially when you're planning to have a pregnancy. And the most common causes for having irregular periods are, it could be simple causes, like usually girls who have recently matured for around 2 to 3 years of uh, after attaining menarche, they may be having irregular periods. Again, 2 to 3 years before you attain menopause, then also you may have irregular periods. In these two conditions, it is very common to have irregular cycles where the hormones are fluctuating a lot. That is 2 to 3 years after attaining menarche and 2 to 3 years before attaining menopause. And the other reasons like excess weight fluctuations, that is either sudden weight gain or sudden weight loss, or even though if it is not sudden also, or gradually, if you are putting on weight over a period of say 1 year, you have put on 10 to 15 kgs of weight, or you have lost around the same amount of weight, then also your cycles can become irregular because of the disturbances in your hormones. One more reason which is common, which can cause your cycles to become irregular, is stress. So too much of stress will put a lot of pressure on your hormones, especially which are produced from your pituitary gland, and which will make your hormones go into imbalance and can cause irregular cycles. And one more common or simple reason why your cycles can become irregular is your poor general health, which can also give irregular cycles or irregular bleedings, or prolonged bleeding or scanty bleeding. And chronic health conditions, if you have any such like renal, liver, your kidney problems or liver problems, or severe anemia, or any chronic health issues, can also give you irregular periods. And the other causes which are of little more concern, which when which can cause irregular periods, are like hormonal problems, like which is very common, that is polycystic ovarian syndrome. The second condition is thyroid disorders, either thyroid excess, that is hyperthyroidism, or thyroid insufficiency, that is hypothyroidism, or one more hormone called prolactin. When it is in excess, we call it as hyperprolactinemia. Even if this hormone is abnormally elevated, then also you can have irregular periods of time, irregular periods of in periods. And other condition like chronic inflammatory conditions, we have two important chronic inflammatory conditions. Chronic inflammation is your organs, they seem to be congested, especially in your lower tummy. The internal organs, they become more vascular. Vascularity to a certain extent is normal, but if there is excess vascularity, we call it as congestion or chronic inflammation, which will produce abnormal local hormones, or we can say abnormal local toxins, which will change the local hormonal environment and affect the ovulation process, which can cause irregular periods. One of these conditions is endometriosis, the other is pelvic inflammatory diseases. With these two are two more situations where a woman can have irregular menstrual cycles. And the other, last but not the least, which is very very important, which is commonly missed, is poor ovarian reserve. That means when your ovaries are having less number of eggs, this is also a reason where you can experience irregular periods, especially women with the poor ovarian reserve. They usually tend to have short cycles. Initially, they may be having in their early age, they may be having a 25, 24, 25 days cycle. Gradually, the cycle will be shortened, maybe 20, 21 days. It is a warning sign that it is one of the symptom that you may be having less number of eggs in your ovaries, which is to be addressed immediately if at all you want to preserve your fertility. So this short cycles should not be neglected, though it seems to be you are having periods every month regularly. You should not neglect this. This is a very common problem now we are seeing in most of the patients who are coming for fertility concerns, where she will be having short cycles since the beginning, and they keep shortening further, and by the time they come to us they will be having around 18 to 20 days of cycle length. When we evaluate them, we find that the egg count has fallen too low, where further treatments become very difficult to make her pregnant. So you should be very cautious when your cycles are getting shortened. The main important thing is whenever you have irregular period, you need to get evaluated properly so that you can take proper help at proper appropriate time, so that your problem can be sorted out. So I will explain in brief like how this irregular periods in different kind of conditions happen. So as I told you, the commonest conditions are like PCOS. In PCOS, which is one of the commonest hormonal imbalance, the hormones which are important for egg growth, which we are coming from your brain, that is LH and FSH, they are not up to the mark, or they go into imbalance, where because of which no egg will get matured. So when there is no maturation, there will not be any ovulation. So when there is no ovulation, there will be very little chances for you to conceive. Or some women, their cycles will be ovulatory in few months or few times, and anovulatory in other times. So say for a woman who is having regular cycles, she will be ovulating for at least 11 to 12 times in a year. So she will be having 11 to 12 egg releases in 1 year. So she will be having around 11 to 12 chances to conceive in 1 year. But in a woman who is not ovulating regularly, like in PCO, 1 month she may be ovulating, the other month she may not be. She may be having cycles for every 2 months. That means she will be having around 6 cycles. That means again in these 6 cycles, she may not be ovulating in every cycle. So there itself, because of the irregular cycles itself, the number of ovulations which happen in 1 year will drop down. So she may be having less chances than a normal woman who doesn't have PCOS. That itself will bring down her chances to conceive normally. So PCOS is such a condition where anovulation is very common, and it is not compulsory that she is not ovulating at all, but she may be ovulating very irregularly. So we need to check like how severe your hormonal imbalance is. Is it like you're ovulating irregularly or not ovulating at all? So depending upon that, we advise the treatment. And again, the next common hormonal imbalance, thyroid. It is very easy to treat the thyroid hormonal imbalance. If you have hypothyroid, we give a small supplement of thyroid hormone, which will correct your thyroid levels and correct your ovulatory problem. Even in thyroid, whether it is hyperthyroid or hypothyroid, both will cause anovulation. That is, the egg maturation and ovulation will not be proper because of improper thyroid levels. And if at all ovulation happens also, even fertilization happens, there will be more chances for a miscarriage to happen because of uncontrolled hormone level, uncontrolled thyroid levels. So you should always get your thyroid levels corrected if at all you come to know that you have thyroid issues. The other hormone is the prolactin. So when your prolactin hormone is very much elevated, your hormones which are important for egg growth, that is FSH and LH, they don't raise, which is important for egg growth. The hormones which are important for egg growth, they are not released from your pituitary gland, because of which there will be no egg growth and no ovulation. Thus the elevation of prolactin, that what we commonly call as hyperprolactinemia, can also give you anovulation, that is absence of ovulation, and thus it will be not possible for you to conceive, and usually you may be having irregular cycles with very scanty flow, or sometimes you may not get period at all, sometimes you may not get period even after giving you medication for withdrawal. That is, we give for 5 days of medication for you to have period. Even with that medicine also, if your prolactin levels are very high, you cannot get your period. So these are the commonest hormonal conditions where you can have irregular cycles. The other two conditions which I have told you is the inflammatory conditions, chronic inflammatory conditions, that is endometriosis and pelvic inflammatory disease. In these two conditions, because of the abnormal atmosphere around your reproductive organs, that is around your uterus and the ovaries, and because of the damage which is caused by these two conditions, there will be a lot of scarring around these your reproductive organs. And because of this scarring and abnormal environment around your ovaries, the ovulation may not happen properly. Even though the egg maturation happens, the ovulation can get affected. The follicle may not rupture because of this abnormal environment around the ovary, or because of the scarring, because of which the egg doesn't come out and it is not fertilized and you cannot conceive. So these endometriosis and pelvic inflammatory diseases can also cause anovulation and thus uh, irregular periods. In these two conditions, again, two more important symptoms what we observe is intermenstrual bleeding. You may be having bleeding in between the cycle, again because of this chronic inflammation, because of the abnormal environment around your reproductive organs. And you may have little more painful period. Sometimes it may be difficult for you to have proper intercourse also when you have endometriosis and PID, that is pelvic inflammatory disease. In endometriosis, usually the pain is much more, and it is in a cyclical pattern. The pain will be more before you get your period, and it is at peak during the period, and it gradually subsides. In chronic inflammatory pelvis or pelvic inflammatory disease, the pain may be constant and which may increase during the period for few days, and then again you will have the pain continuously throughout the cycle. And as I already discussed, one more condition where you will have less chances to conceive because of irregular cycles is the poor ovarian reserve, where you will have very short cycles. There will not be enough time for the egg to mature, because of which the egg may be released in a very immature state, or because of abnormal maturation of the egg, or because of abnormality in the hormones. Even before the implantation happens, the endometrium, the uterine line can get shed. So that is, the ovarian cycle and the uterine cycles may not be synchronized because of the hormonal imbalance. So some, because of which the implantation will not happen and the women may not conceive. So these are few conditions where you can have irregular cycles. So when you notice that you have this kind of irregular cycler pattern, like cycle shorter than 21 days or cycle longer than 35 days, or when you are not able to predict your cycle, when you are going to get your cycle, then it is time for you to approach your doctor and get evaluated properly. So usually when you come with a complaint of irregular cycles, we do very simple tests. One of the simple tests is a simple ultrasound. So we do an ultrasound scan where we look for the uterus, we look for the uterus lining, and we look for the ovaries. We see whether you have any of these problems like PCO or endometriosis or pelvic inflammatory disease, or whether your ovaries are having sufficient eggs or not. On scan, we see these conditions. After the scan, we do basic hormonal tests, very basic hormone tests. We usually asks for hormones on your second day of your period, like FSH, follicular stimulating hormone, LH, luteinizing hormone, prolactin, your thyroid, TSH, thyroid stimulating hormone. And for some women where we are little doubtful about your egg reserve, as I told you, egg count, or when we think that your egg count is less, we may ask you to get one more hormone called anti-Mullerian hormone, that is AMH. So depending upon the level of these hormones, whether they are normal or abnormal, we decide what kind of treatment we have to do. So these are the basic tests which we do for a woman who come to us with irregular periods. A simple scan and a day 2 or day 3 hormones, which will tell us mostly about where could be the problem is. So once we know what the problem is, like if you have PCOS, we usually advise uh, lifestyle corrections, and then depending upon the age and depending upon your fertility requirement, we decide what kind of treatment we give. In every condition, whatever condition you have, depending upon your age and your requirement for fertility, and also depending upon the problem, we decide what kind of treatment we have to give. If you're younger, we try to go a little slowly and conservatively without much treatment. If especially if you don't have severe problems, we try to give minimal treatment, and most of the times it will be with lifestyle corrections and little supplements like folic acid, something like that. And most of the times, if you have minor issues like weight problem or PCOS or hypothyroidism and prolactin, elevated prolactin, these can be easily handled when they are properly treated, especially with lifestyle corrections and very minimal medication. But if your age is more, like more than 35 years of age, and you're married for a longer period, and the problem is little severe, and you have already tried many kinds of treatment and still not able to conceive, then we go with advanced treatments, uh, again depending upon the conditions, to make sure that you conceive as early as possible. Especially when you have conditions like endometriosis, we when we do a scan, we uh, grade the endometriosis, like in what stage you are in, whether you are in first stage or fourth stage. If you are in first and second stage, again we can give you conservative treatment or IUI we can do. But if you are in third or fourth stage, we may go with advanced treatments like IVF and all, so that you conceive before the situation worsens further. Again, in conditions like poor ovarian reserve, where the egg count is low, where you have in these conditions, where you will have more chances to get menopause at an earlier age. In these conditions, again we uh, go little quickly for further treatments. Maybe we can start with IUI and then proceed with IVF if at all it seems to be required, it seems important. Then we may have to escalate to the treatment to uh, IVF treatments, so that you conceive as early as possible before your egg count falls further, where we cannot use your eggs, or you will not be left with any eggs to try for even IVF. Or we have to see that you conceive before your count falls to zero, or before you get menopause, or where you get into a situation where you need a donor egg. So before getting into that kind of situation, we should see that you conceive. So for that condition also, like poor ovarian reserve, it is very important for timely treatment, where what the treatment we do will give us optimal results. And for other common conditions which I have explained, like weight as a reason for irregular periods, or stress as a reason for irregular periods, and poor general health, I think again it is very much clear that once you correct these things with simple lifestyle modifications, your irregular cycles can be easily treated or easily handled. So it is very important for a woman who have irregular cycles to understand, like first to understand her normal menstrual pattern, and to understand like where she is, whether she is having really irregular cycles or not. If at all she is having irregular cycles, it is important for her to know whether she's ovulating or not. If at all she's not ovulating, we should know the reason for her anovulation or the reason for which she is not able to ovulate, and treat accordingly. And especially it is very important uh, to see that timely the treatment is given, especially in women who are of advanced age and who are of having conditions like endometriosis or poor ovarian reserve. Timely treatment is very, very, very important. I cannot tell you how important it is, because it's like now or never. If you get treated on time, you will have optimal results. If you realize it later and then you get ready for the treatment also, the results may not be optimal. So it is very important to have a timely treatment. So you should know about your body. You should know, you have every right to know about your menstrual health, and you have every right, you should be ready to accept what the problem you have, and you should be ready to undergo the treatment whatever your doctor suggests. And you should to decide for what, whether you have to go for the treatment or not. It is very important to have knowledge about your menstrual cycles and what is abnormal and abnormal, so that you can take proper decision at proper time and get the treatment done. So So if you have any further doubts, you can either mail or put a message so that I can answer your queries.